Hi, everyone, again. Well, thank you very much for the invitation to your conference. So I was introduced already. It's okay. So just to say, yes, I will be presenting the results of the COVID-19 Disability Rights Monitor, of which the European Network on Independent Living is a member. Now, because I have only 10 minutes for my presentation, I will present really the main findings. I will not focus on our recommendations today. And I will just give you a glimpse of really what we found. There will be an opportunity to find out more later in the month for those of you who are interested. So first of all, just a couple of words about the COVID-19 DRM, as we call it. So we launched this initiative, the survey, in April, mid-April this year, together with 6 other organizations: Validity Foundation, International Disability Alliance, Disability Rights International, the Center for Human Rights at the University of Pretoria, the International Disability and Development Consortium, and the Disability Rights Fund. We also received endorsement from 2 of the then UN Special Rapporteurs on health and on persons with disabilities, and also from the independent expert on the enjoyment of human rights by persons with albinism. So the Disability Rights Monitor was really a big survey composed of 3 components, with questions aimed at governments, at persons with disabilities and their representative organizations, and at national human rights monitoring mechanisms. The reason for having these 3 components was that so we could triangulate the information, really compare information received from different sources. And our main aim was really, it was a rapid response survey. Our main aim was to collect information on what countries around the world, so globally, were doing to protect the core rights of disabled people during the pandemic. By the core rights, we understood the right to life, access to health and essential services, and freedom from torture and ill treatment. The survey focused particularly also on the situations of those considered to be at heightened vulnerability, so people in institutional care settings, children, older persons, homeless people, and people living in rural and remote settings. The survey was open for approximately 4 months, and we've received over 2,000, so 2,152 responses from 135 countries all over the world. We have had more than 3,000 written testimonies among these responses. Just as a matter of interest, actually, the highest number of responses we received was from Germany. So we've had 225 responses from Germany, followed by Italy, France, Austria, and the United States of America. The survey findings can be grouped under 4 different headings, and this is how I'll present them as well. So focusing on measures to protect disabled people in institutions, measures to protect disabled people in the community, underrepresented groups of disabled people, and access to healthcare. And I will start immediately with measures to protect disabled people in institutions. So the overall finding was that 33% of all respondents found that no measures were taken to protect the lives, health, and safety of disabled people in institutions. 50% of people said that some measures have been taken, and 70% of people said that significant measures have been taken in their countries. Here we've received 329 testimonies focusing on the situation of people in institutions. Just to clarify, by institutions, we mean social care institutions, group homes, psychiatric institutions, retirement homes, but also residential schools for children. By failure to protect the lives, health, and safety, Respondents mentioned that people in institutions were denied access to healthcare, that they were isolated during COVID outbreaks. They mentioned lack of access to food and medical supplies in institutions, understaffing and poorly trained staff. And of course, in the worst cases, institutions became hotbeds of infection and death. And as we know, in some countries, the deaths in institutional care settings accounted for more than 50% of all deaths from COVID-19. So this is the first finding. Staying on the situation of persons living in institutions, we can see that 69% of residents, 69% of respondents said that residents were banned from leaving institutions during COVID-19. 84% of respondents said that family, friends, and others were banned from social care settings. And 82% of respondents said that family, friends, and others were banned from visiting psychiatric care settings. So this finding points to, of course, further deprivation of liberty of those living in institutions. What this means essentially that people in institutions were and still are cut off from the rest of the world, also without any independent monitoring of these places. Most of the national human rights institutions and other bodies with a mandate to visit institutions stopped their visits at the beginning of the pandemic, and some had only resumed during this summer. So here we've had respondents express, of course, concerns about the mental health of people living in these settings. Again, staying on the situation in institutions, we've had a question about the extent to which people living in institutions were informed about the state of emergency, so had any idea about what was going on. Here, 26% of respondents stated that no measures were taken to inform people living in institutions about the state of emergency, including about the bans and restriction on visitors. And here I have one quote from India, from an organization of people with disabilities, where a respondent said, "A few things have been put up online at relevant government portals, but most persons with disabilities have no access to those staying in institutions. Perhaps they don't even know what is going on outside." So this means that people in institutions, in many cases, had no idea about really why they were being cut off from the rest of the world, why they were put into this situation, what was happening, and also had no information about how to protect themselves within the institution itself. And the final slide on the situation in institutions focuses on older people living in institutions. Here, 1/3 of respondents said that no measures were taken to protect the life, health, and safety of older people with disabilities in institutions. Major concerns have been, of course, expressed about the effects of isolation on the mental health of older people with disabilities in institutions. And again, here we have a quote from Italy, from a disabled person who said, "Many people didn't even have an explanation why they couldn't see their families anymore. Many older people thought they were abandoned and left to die." I would just like to say that where measures have been taken in places where older people with disabilities were living, these measures were found to be by the respondents sometimes highly problematic. Again, the most complaints were expressed about the bans on visitors, about the isolation, about the lack of monitoring of these places. Moving on from institutions, I will focus on the findings from the community. And here, let me start by saying that 45% of respondents said that no measures were taken to protect the life, health, and safety of people with disabilities living in the community, which meant that many people were abandoned and trapped at home with no access to food, medicine, or other basic supplies. In countries where there were strict curfews, many people said that they found themselves at risk of police harassment and were afraid of what was going to happen if they went out. Um, in many countries, many respondents told us about the breakdown of community supports during COVID 19. And so 38% of respondents said that they've had no access to personal assistance during the pandemic. 33% said that they had no access to informal care. 29% said that they had no access to home support. And 23% of respondents said that they had no access to assistive technology. Also, a very small minority of people said that they had any extra financial support from their governments during the pandemic to cover the cost of hiring extra assistants or any other needs that didn't exist before the pandemic. And so, as a result of this, of course, many people have lost their independence during the pandemic. They were forced to rely on volunteers, on family, friends, on NGOs for any kind of support. Staying in the measures taken in the community, there are two other main themes, and that is access to information. So firstly, 30% of people said that persons with disabilities did not receive enough information about the prevention of COVID-19. And 21% of respondents said that information was not available in any accessible formats. When information was provided, it was often found by people to be unclear and confusing. And there have been also concerns expressed by people about those who had no access to TV, radio, or internet during the pandemic, about how they were accessing information. In terms of accessible information that was available, the most widely available format was sign language, so that was provided in 44% of cases. Then easy to read in 38% of cases, and audio format, which was provided in 33% of cases. The other major concern, as I said, was about access to food and essentials. In this case, almost 1/3 of all respondents in 81 countries, so we are talking about hundreds of people here, said that persons with disabilities could not access food during the pandemic. And I would like to here point out that we are not talking here about middle income or low income countries. There was a high proportion of respondents in high income countries who said they were not able to access food. Among these countries were Canada, the US, United Kingdom, Belgium, and France. So some of this shortage of food was alleviated by NGOs who engaged in food distribution among disabled people. And a lot of people, of course, relied on informal supports, on volunteers to be able to access food. And the final slide of focusing on the community settings focuses on the incidences of police brutality, harassment, and abuse. So here the majority of respondents, 77%, said that they did not have information about penalties resulting from breaking the state of emergency rules. Of course, some people with disabilities were forced to break curfew rules, had no choice but to break them in order to access essential food and medical supplies. A lot of people in Europe expressed fear of police, for example, in Italy, the UK, or France, and found the police to be unreasonable and heavy handed, with fines and other sanctions taken against people who went out for walks or simply to get food or essential supplies. People also said that they have been harassed when trying to visit loved ones living in institutions. And we've had 370 written testimonies from all continents about police harassment, torture, and murder of persons with disabilities and their family members. There was quite a few murders documented and also shared via our survey, mainly in the global south, but also the US. Um, Moving on to underrepresented groups of disabled people and their experience during COVID. As I said, we're talking here about children, women, homeless people, and people in rural areas. There are more underrepresented groups, of course, among disabled people, but we've had questions in the survey specifically about these groups. So here, 41, speaking about children, 41% of respondents said that their government has taken no measures to protect the life, health, and safety of children with disabilities. 45% said that their government has taken some measures, and 14% said that their government has taken significant measures to protect children with disabilities. This meant that children with disabilities in many countries did not have access to essential health care, respite, rehabilitation, or education. In many cases, children with disabilities were excluded from remote schooling programs. And also just to add that 55% of respondents said that no measures were taken to support the families of children with disabilities. Moving on to the homeless population, here the respondents said that 51% of governments had taken no measures to protect the life, health, and safety of people with disabilities living on the streets or in homeless shelters. 41% said that their government has taken some measures, and only 8% of respondents said that their government has taken significant measures to protect this population. Particular concerns were expressed about children with disabilities living on the street. We've also received information about the increased risk of homelessness among disabled people in general, and about people from the streets being moved into institutions for disabled people during the pandemic. And finally, there was information shared about concerns about infections in homeless shelters where disabled people found themselves moved to. Just a couple of points about women and girls about disabilities. Here we've had reports of sexual assault, domestic violence, and police brutality against this group. And in terms of people living in rural areas, 59% of respondents said that their governments had taken no measures to ensure that people living in rural and remote areas were protected during COVID-19. My final slide focuses on access to healthcare, which was another, of course, major theme that came through in the responses. When it comes to access to healthcare, there were two really main concerns. The first was the denial of treatment for COVID-19 and discrimination in triage against disabled people. And the second theme was no access to medication and essential health care. When it comes to denial of treatment and triage discrimination, the majority of respondents, so 52%, said that they were denied or deprived of healthcare for COVID-19 during the pandemic. And we've had written testimonies from Canada, the UK, the US, Austria, Luxembourg, the Netherlands, Georgia, and France, where people said that triage guidelines discriminated against persons with disabilities with COVID-19 in the event of shortage of hospital places. So here, some of the people were informed at home that they would not be treated, that they would not be prioritized during if they caught COVID. Some people received do not resuscitate, were informed that do not resuscitate notices had been placed against their names by their general practitioners. Um, I would like to add here that a lot of people also spoke about having no access to rehabilitation and therapies during the pandemic. And also, people said that they've had no information, no access to information while they were hospitalized, because, for example, sign language interpreters were not allowed to be present in hospital with them. Of course, this whole situation, the denial of treatment for COVID and the discrimination in triage, resulted in preventable deaths among disabled people. And the final theme is the no access to medication and essential healthcare. And here, 47% of respondents said that their government took no measures to ensure access to specialized medical care, including pain relief and various types of treatment required, for example, by people with psychosocial disabilities. So these are our main findings. I would like to just say as a final note that we will have a global launch of our report on the 22nd of October from 3 to 5 p.m. Of course, it will be an online event. Whoever is interested is very welcome to attend. We will present these findings in more detail and also, of course, focus on the recommendations, because we still are in the middle of this pandemic, and the recommendations are focused on the current situation, but also on the recovery phase. And finally, our interactive dashboard is still alive, so you are all welcome to visit our website, www.covid/drm.org, and browse through these findings, which you can search through by country or by theme. So okay. I will stop here, and thank you very much for your attention.